Hi friends, welcome to everyone. I am Sendil Kumar, physiotherapist and a yoga therapist at Fitness Canada Physio and Massage Center, Calgary, Canada. In this pandemic situation, we all know the coronavirus mainly affects the lungs. Now, in this video, I'm going to explain about the three major issues or problems faced by the corona affected people's lungs and the effective breathing technique by which they can overcome those major problems. The major difficulty faced by the COVID affected patients are number one, inability to use their lungs to their full capacity. Number two, difficulty in clearing the secretions or phlegm from the deeper aspect of the lung so that their airways are clear to absorb more air in. And finally, number three, importantly, inability to maintain or improve their oxygen saturation level. In this video, we are going to demonstrate a very important technique called effective breathing technique, by which you can increase your oxygen saturation levels, increase the clearance of the secretions from the lungs, and also you can maximize your lung capacity. So it is in two levels. As you know, our breath has two major components. One is inhalation or breathing in, and number two, exhalation or breath out. It could be expanded into four components. That is, breath in or inhalation. Number two, whole time after inhalation. Number three, exhalation. And number four, whole time after exhalation. The effective breathing depends upon the duration of each one of these components. Number two, the depth of each one of these components and the force with which these components happen. So with the effective breathing technique, we are going to do it in two levels, and each level will concentrate in improving our breath in all these three components. As you know, with COVID patients, positioning, importantly, lying on the tummy, which is called as proning, is advised for better oxygen saturation. But this positioning is not doable comfortably by many people. So this effective breathing technique that I'm going to demonstrate to you today will be a good alternative for the prone positioning or lying on the tummy. For those who feel difficulty lying on the tummy, they can do these effective breathing technique in order to improve their oxygen saturation level and improve the lung capacity. The effective breathing technique. This we are going to do in two components. In the first component, we are going to try expanding every part of the chest voluntarily in all dimensions. And this again has three parts. Number one, diaphragmatic breathing. Number two, thoracic breathing. And number three, clavicular breathing. Number one, diaphragmatic breathing. So the first, diaphragmatic breathing technique. So you're going to sit in a comfortable position. Have one hand on your abdomen just below your chest. Now, you're going to slowly breathe in, concentrating and trying to observe what happens with your diaphragm. As you breathe in, you can feel that the diaphragm is moving down, pushing the abdominal content outwards and downwards, which will move your hand up and outwards. As you breathe out, your hand moves inwards. So I'm going to show you how that happens. As you breathe in, your hand moves out, and as you breathe out, your hand moves in. You're going to concentrate and do as if you are directing the air that enters inside your body towards your hand. Once again. At the end of your exhalation, you can give a mild overpressure with your hand that will clear the air completely before you take your next breath in. I will demonstrate one more time. At the end of the breath out, I'm going to give a mild pressure and then I will continue with my inhalation. Okay, that is simple diaphragmatic breathing exercise. The next one is the most important, thoracic breathing exercises. Next is thoracic expansion exercise. For this, again, sit in the comfortable position and place both your hands on either side of your last 2 to 3 ribs. And as you breathe in, you're going to concentrate as if you are directing the air to flow under your hands, that is, towards the base of the lungs. Okay, I'm going to demonstrate that once. As you breathe in, breathe out. Now, at the end of the breathe out, you can apply a mild overpressure before you start your breathe in. That is the thoracic expansion exercise. This will improve the gaseous exchange because generally there will be more blood or perfusion in the base of the lungs compared to the upper area of the lungs. On the other hand, there will be more gaseous flow in the upper portions of the lung compared to the lower portions of the lung. So as you are directing the air more towards the lower portion of the lungs with these techniques, you will be enable your lungs to improve the gaseous exchange. You can do this thoracic expansion exercises unilaterally, that is one side alone. If you feel that there is any restrictions or constrictions on one side of the lungs, then you can do unilateral thoracic expansion exercise. I'm going to demonstrate that now. So you're going to have one hand, usually your opposite hand, on the lower portion of the ribs. For the right side, I'm using my left hand. I'm going to place my hand on the last 2 to 3 ribs of my right chest. Now, as I inhale, I can feel that my hands are going out and up, and as I exhale, in order to superimpose this position, now I'm going to bend a bit to the opposite side to encourage more air flowing to that restricted side. So observe this. As I inhale, as I exhale, you can do that on the other side too. For the left side, I'm going to use my right hand. So as I inhale, I'm going to bend towards my left side. As I exhale, I'm bending towards the same side. As I inhale, I'm bending towards the opposite side. That completes one cycle. The third, clavicular breathing. Here, we are going to improve the gaseous exchange in the upper portion of the lungs, which is very easy. You're going to have one of your hand on the upper portion of the lungs over and above your clavicle or collarbone. So, as you breathe in, you are going to imagine as if the air is getting directed under your hands, that is to the upper portion of the hand where you have your hands, upper portion of the chest where you have your hands. So you can do that using your opposite hand to the other side. Coming to the component 2. In this, we are going to expand our lungs time-wise. That means we are going to make the breath more deeper and longer. This again has 3 levels. In the first level, we are going to concentrate only on the breath in and breath out. That is inhalation and exhalation. The ratio would be 4:4. That is, inhaling to a count of 4 and exhaling to a count of 4. The important thing here is throughout the counting, the inhalation as well as exhalation should be regular. It cannot be hurried in the initial stage and it cannot end sooner. You can choose a number according to your convenience. If you're not convenient to hold or prolong your breath for a count of 4, you can go with 3 or as low as possible to start with. So I'm going to demonstrate with a ratio of 4:4. What I'm going to do, I'm simply going to inhale for a count of 4. And I'm going to exhale for a count of 4. Again. Coming to level 2, here we are going to introduce breath hold. Breath hold is so important because you have to remember that the gaseous exchange in the lung happens only during breath hold, not during your inhalation or exhalation. So, breath hold component is very important in a breathing cycle. So here the ratio will become 4:2:4:2. What we are going to do, we are going to breathe in for a number of 4 and then hold for a number of 2 after inhalation and then breathe out for a number of 4 and then again hold for a number of 2 after exhalation. I'm going to demonstrate. Breathe in, hold for 2 and then breathe out. Hold for 2 and then breathe in. Hold for 2 and then breathe out. So the cycle continues. In the third level, the ratio would become 4:2:1 and 4:2:1. So what we're going to do, after breathing in for a count of 4 and holding in for a count of 2, you're going to take a stiff for a count of 1. That means you're going to take a little bit more air in for a count of 1 before you start exhaling. So similarly, after exhaling for a count of 4 and a hold for a count of 2, you are going to compress your abdominals and release a bit more air out before you start your next inhalation. I'm going to demonstrate that now. Breathe in, hold, and I'm going to take one and then breathe out. Hold and compress your abdomen for one and then breathe in. Hold and then breathe out. Hold and then breathe in. The cycle continues. So all these components, it's advisable to do minimum 6 repetitions, and all these components will help in improving your thoracic capacity or lung capacity. As you progress, you can increase the numbers of the basic components. Like for example, if 4:2:1 can be changed into 6:3:2. Same way, as you progress, you can keep increasing the numbers depending upon your lung capacity. Importantly, you should not stress yourself out by trying to increase the numbers beyond your capacity. So, always try to have calm and relaxed breathing so that you are not stressing out and causing tension in your system. It's quite natural to feel as if you want to spit sputum. If so, please spit it out and clear your airways. If you still feel difficulty in clearing your airways, or if you still feel congestion in your airways or in your lungs, then you have to watch our next video where we will be teaching you about how effectively you can use the huffing and coughing techniques to clear your upper respiratory tract. Thank you so much for watching this video.